I think that the progress in prostate cancer has been so great over the last 25 years, and particularly even over the last 5 years, we've had multiple drugs that have been discovered, gone through the FDA and approved. We're going to realize the benefits of that coming up. One of the main reasons that we think that prostate cancer might have had a change is that about 8 to 10 years ago, there was a change in the national recommendation for prostate cancer screening, and it was what we call a downgrade to say don't screen. The consequences of that have been very clear, that now we're diagnosing more men with higher stage, higher grade cancers, more metastasis from cancer. Luckily, 3 or 4 years ago, they changed back the decision, and now they're recommending more prostate cancer screening. The best way that we know of right now to catch prostate cancer is a PSA test. It's a simple blood test, non-invasive, just a blood test showing a PSA measurement, and then you have a biopsy. That's the best way to diagnose prostate cancer now. The overwhelming majority of men that are diagnosed with prostate cancer are cured and do not die of their prostate cancer. There are multiple studies looking at newer, either urine-based tests or blood-based tests to find prostate cancer earlier than PSA. Almost all those are using PSA in conjunction with those tests. So there are multiple other tests trying to come out in the market right now, but as of yet, nothing that's considered standard of care. We have been, again, at UW-Medicine at the Fred Hutch Cancer Center, been learning much more about the genetics of prostate cancer. And so if one has prostate cancer in their family, but what's very interesting is that if one has breast cancer, ovarian cancer, they're linked. So the same genes that cause breast cancer, the BRCA or BRCA gene family, can also be involved in prostate cancer. And so we encourage men and their family members who have those cancers to get screened and get screened early with PSA.